How the silver plans influence your monthly subsidy for health insurance through Covered California. Hello, I am Kevin Knaus with InsureMeKevin.com, and the calculation for the subsidy through Covered California is complicated, and sometimes it doesn't make much sense. I will have people that will call me and say that they are paying way more one year than they did the previous year, and then other people say that their health insurance premiums went down because the subsidy got larger. So what's going on? So what I've done is created a comparison between 2023 and 2024 for a particular consumer, so to kind of show you how the subsidies can change based on the second lowest cost silver plan. Now, part of the equation is this thing called the consumer responsibility percentage, and it's in the IRS Form 8962, and it will change every year, especially if your income is static. So because the federal poverty level increases every year, and if your income is the same, then you have a lower consumer responsibility, which means you have a higher subsidy. But I don't want to dive into that too much. Let's look at the consumer profile I created, which was for an individual. Their estimated income is $50,000. In 2023, they were 40 years old. And then for a real comparison, in 2024, I ran the numbers with a 41-year-old individual. Now, that consumer responsibility that I was mentioning, because the federal poverty level increased between 2023 and 2024, the consumer responsibility for this individual went from 8.2% down to 7.08%. And it makes about anywhere from $50 to $120 per month difference in the subsidy. Now, we have to remember there are 19 different rating regions in California. Some of those regions include many counties, and some of them are just one county. But let's start with San Diego County, which it is its own region. And for the 40-year-old, $50,000 income, the second lowest cost silver plan was the Molina HMO. And that individual is receiving $51.64 based on that second lowest cost silver plan to apply to any health plan they selected, bronze, silver, gold, or platinum. In 2024, the second lowest cost silver plan became the Blue Cross HMO. And what I did is, you can see the full rate there, which is just the subsidized rate plus the subsidy. And the subsidy in 2024 went up to $107. The change in the rate for the second lowest cost silver plan, regardless of who the carrier is, the health plan, was 8.02%. And because that went up 8%, some of the other plans that this 41-year-old individual may enroll with actually went down year to year. So the Sharp Premium, the HealthNet HMO, they went down along with the Kaiser and the Sharp Preferred. But we can see that the Blue Shield HMO and the HealthNet PPO obviously had a larger increase in the full rate that was greater than 8% and greater than the consumer responsibility percentage. So those rates actually went up year over year, but not too bad overall. Next, I looked at Orange County, and you can see the second lowest cost silver plan was Blue Shield HMO for both years. And it had a whopping increase of 20% between 2023 and 2024. Now also, there is a built-in rate increase because the individual gets 1 year older and the rates are higher, anywhere from 3 to 4%, going from one age to the next year. But because that was so large of a rate increase, the subsidy jumped about $100, and it made all of the health plans in Orange County offered to this individual lower in the silver plan metal tier level. With Los Angeles, the second lowest cost silver plan was the Blue Cross HMO in 2023, and then Molina became the second lowest cost silver plan with a 11% rate increase year over year for that 41-year-old individual. And many of the plans in the silver category did go down, but we can see that the Blue Shield HMO, the Health Net PPO, and the Blue Shield PPO went up for that particular individual. And if you were in those plans, you would notice an increase. Now, in Northern California, the rates can be considerably higher, sometimes, 50% higher than Southern California. But the way the subsidy calculation is, it's all based on the second lowest cost silver plan and making that health insurance premium no more than a certain percentage of your household income, that consumer responsibility percentage. So let's look at Santa Clara County. You can see that the subsidy between 2023 and 2024 jumped from $170 to $245 per month for this individual with an estimated income of $50,000. I will also note that the second lowest cost silver plan in 2023 was the Kaiser HMO at $320.58. Matter of fact, no matter where you go in California, no matter who the second lowest cost silver plan is, that is the rate in 2023 for this individual 40-year-old with a $50,000 income. And in 2024, you'll also notice that the second lowest cost silver plan for this individual, same income, was $294.72. The Kaiser went up 10.07%. They have their inflation, and of course the person is a year older. And the other plans in Santa Clara County, specifically the Blue Cross EPO and the Blue Shield plans, increased more than that. So if that individual's in those plans, they would see a rate increase. But if you were in the Kaiser, you saw a rate decrease. So you get a year older, your income stays the same, and your health insurance premium goes down. Moving up to San Francisco County, a Blue Shield was the second lowest cost silver plan. It was displaced by Kaiser, and the year-over-year rate increase was 11.37%. And of course, that Blue Shield HMO, it had a healthy increase for 2024, so it got a little bit higher for members. The Chinese Community Health Plan balance, that actually went down, and the Blue Shield PPO plan went up. Going into the North Bay, Sonoma County, the Kaiser HMO stayed the second lowest cost silver plan, only went up 6%, year over year, which meant the Western Health Advantage, which did not go up very much, saw a big decrease. And those folks in the Kaiser plan saw a decrease because the subsidy went up, at least for this individual, from $209 to $267. But the Blue Cross EPO and the Blue Shield PPO, they went up a larger amount, so you have to pay a little bit more if you're in those plans. Going over to Sacramento County, and this is where we can really see some disparities that are created with the second lowest cost silver plan. In 2023, it was the Aetna CVS, and then Western Health Advantage became the second lowest cost silver plan with a very small year-over-year rate increase between 40 and 41 years old of 4.86%. And that was not very large, and so most of the other plans that people were in, they saw a rate increase because all of their rates went up more than 4.86%. So even though the subsidy went from about 190 to 240, that wasn't enough to keep pace with rate increases with Kaiser, the Blue Shield HMO, and the Blue Cross EPO, and the Blue Shield PPO. So we have seen that before, where sometimes a new carrier comes in and maintains a second lowest cost silver plan that really doesn't go up much in rates, which means there is not much of a subsidy increase for those people in that particular region. Then we go to Nevada County, where there are fewer carriers. And it's interesting that the Blue Shield PPO has always been the second lowest cost silver plan, and their rates have been going up pretty good the last couple of years. But it's all good up in Region 1, Nevada County, and those counties, because those people get the benefit of that large 16% rate increase going from 1 year to the next, getting a year older. And so the subsidy jumped $129 between 2023 and 2024. So all of the rates went down. So that is kind of a survey of what's going on in California. It's very hard to predict how your subsidy may be affected in general in 2024, because rates went up so much from 2023. Most of the people are benefiting from that increase in subsidy. But there are some people, like in Sacramento County, where, some of the plans, they went up faster than that second lowest cost silver plan. So if you have any questions or comments, you may leave those down below. I will do my best to answer them. For InsureMeKevin.com, I'm Kevin Knaus.